Sometimes you don't realize the importance of a body part until it no longer works as it should. For me, it's been my right knee, one of the strongest and most important joints in the human body. So when ligaments tear, when arthritis sets in, when it's difficult to control inflammation, it can severely alter your quality of life. In a three-part series we'll be airing over the next few days, I bring you an intimate look at my struggles to regain the use of my knee.
Hi, nice to meet you.
I finally had to break down and make an appointment with an orthopedic specialist. After 3 knee operations and many months of physical therapy, it wasn't something I was exactly looking forward to.
The cushioning, the cartilage that you used to walk on in your knee is pretty worn out.
I had known for a while that the arthritis in my knee was bad. After all, I had an uncanny ability to predict impending snowstorms. What I didn't realize is how much damage it can do. Dr. Brian Polsky termed what I had as end-stage degenerative arthritis.
You're typically born with about 1 centimeter of cushioning, and you basically have barely 1 millimeter left.
The knee has 2 types of cartilage inside the joint. The meniscus provides a cushion between bones. Articular cartilage covers the end of the thigh, the top of the shin, and the back of the kneecap. There's no way to restore cartilage, so when it's gone, it's gone.
So when you have hardly any cartilage left, you feel it all the time. Achy, stiff, sore, dancing, stairs, even sleeping is uncomfortable.
That's because bone has a lot of nerve endings, so when cartilage wears down, you feel it all the time, like I did. But it took seeing the X-ray and MRI results to really understand the magnitude of the problem. Dr. Polsky explains that everywhere you see white, there's a problem.
All this white should be black, and you really hardly have any left. In fact, there's a little area here that's completely bare, and some over here that's completely bare, and that's typically what we call bone on bone.
Okay, and this white spot right here is...
So this up here is some swelling, some fluid.
That's what's been bothering you right in here.
Yeah,
Okay.
exactly. And so what happens is when you have this, it irritates your knee, and then the lining of your knee makes fluid, and then your knee gets stiff. As far as things like arthroscopic surgery, that is typically used to clean up torn meniscus. You don't really even have much meniscus left at all.
Then there's the Anterior Cruciate ligament, or ACL, one of 2 anterior ligaments that hold the knee together. Mine was replaced nearly 2 decades ago.
Okay.
So the ACL's okay?
The ACL is pretty degenerated as well, because what typically happens is as your knee wears out, it puts a lot of stress on the surrounding ligaments, and they start wearing as well.
So how bad is the injury then?
At this point, I realize that another surgery is in my future, hoping beyond hope that it isn't a total knee replacement.
The only real cure for what you have is a knee replacement.
And the panic begins to set in. Can I take that much time off of work? How much will this cost? Don't they have to saw off the leg bones to take out my knee?
People think that I cut their leg up here and down here and take the whole knee out, and that's not really what we do.
Dr. Polsky explains that a total knee replacement is usually a last option when the pain is too great and when you can't exercise or resume normal work and recreation activities.
So a total knee replacement is kind of like retreading a tire. So we carefully reshape the end of a bone that has no cartilage on it, and then we cap that with specially sized and shaped metal parts that recreate the shape and function of the knee. So the human knee moves in flexion and extension like this, as well as rotation.
After more than 4 months of hurting all the time, unable to do long walks or my favorite hobby, I knew it was the only option. After all, I wanted to eventually get back on the dance floor.
And dancing has been a big part of my life for the last 12 years, and I can't imagine living out my years sedentary. In part 2 of this series, Journey to a Bionic Knee, you'll get a rare inside look at the surgery itself, my total knee replacement from start to finish. Be sure to join us tomorrow. Yesterday, you learned about the decades-long struggle with my right knee and how I no longer had a choice but to replace the joint. Today, I bring you my personal journey to the hospital for a behind-the-scenes look at my total knee replacement surgery. We must warn you that the video is real footage from the operation, and although we blurred out some shots, parts of the story contain graphic images.
Account numbers and the amount that's paid and what's out of pay and what needs to be paid. I've taken care of everything.
It's been 2 months since I first learned I would need a total knee replacement. Time enough to prepare all of the paperwork, my finances, and prep my 2 sons who would be my primary caretakers. Yet here I was on the morning of the operation going over everything with them. This after getting up at 4 a.m. for my 7:30 surgery. What was I thinking? At the moment, all that's running through my head are the risks of the surgery.
So it's still big surgery. So you still worry about bleeding, worry about blood clots, worry about infection, worry about stiffness. So those we all address very aggressively. Anesthesia does have its own set of risks, but again, these days with regional anesthesia, spinals, and things like that, it's really at a minimum.
After checking in at Northwest Hospital in Randallstown, I'm brought to a back room to prep for the operation.
So there's 2 wipes. We want everything wiped down.
For 3 days prior to surgery, I was given a special soap to bathe with every night. From the beginning, it's clear that the risk of infection is taken quite seriously. After vitals are taken in an IV set, my surgeon arrives.
Dr. Polsky,
Dr. Polsky, nice to meet you.
He tells my sons what to expect during the operation, how to care for their mother afterward, and most important, how to spot signs of infection. He then signs his initials on my knee, a standard practice to make sure the correct limb is operated on.
I'll come talk to you guys as soon as I'm done, okay? And then you'll be able to see her probably about an hour later. Okay?
The first few nights at home, it's going to be important to have people around so there's no falling, people are safe getting around, going to the bathroom, basic necessities.
And now it's time to head into the operating room. When I walk in and see the various drill bits lined up on the table, I almost pass out without painkillers. Kidding aside, I decide on a spinal instead of general anesthesia to get me up on my feet faster. I'll still be sedated through the procedure, but only numbed from the waist down. Once the anesthesia takes effect, my arms are strapped outward to prevent them from getting in the way of the surgery. The whole team must use protective clothing, some with what's known as surgical spacesuits. Even my photographer had to scrub in. Once the incision is made, scissors are used to cut tissue and sutures. Drilling is to help guide the screw placements. Saws are for bone cuts. A hammer is used to choose which size implant best fits my knee. Veins are then cauterized to stop the bleeding, and suction is used to clean out the area.
The metal parts are permanent, they don't wear at all, but the plastic part can wear out. Nowadays, the plastic parts we use are 25 plus years.
The whole operation takes about an hour and 20 minutes and about another hour in recovery.
So they tell me I've been out of surgery now in the recovery room for about an hour. They're hoping to get me up on my feet really soon. I think I got a shot of the little balloons on my legs. They keep pumping so that I don't end up with blood clots. That's the main concern. Pneumonia, they don't want me to be laying down like this too long. Prevent pneumonia.
2 hours after the operation, I'm wheeled into my hospital room where my sons are waiting.
So they did something really interesting. They inserted Q-tips with betadine up my nose to prevent MRSA.
I fill them in on the details, at least what I remember. A technician then comes into the room to take an x-ray of my new bionic knee. From this point on, I will set off those metal detectors at the airport. Physical therapy begins almost immediately. Just 2 hours after surgery ends, I'm on my feet for the first time, a bit wobbly, but walking nonetheless.
Put your hands back to sit. That's okay. Good. Oh, do I need a leg lift? No. Okay.
When I first started, they used to bring folks in a couple nights before the procedure and prepare them for the procedure. Nowadays, it's 1, maybe 2 nights in the hospital. And there's actually, I've even done 1 patient outpatient. If they're safe and they're eating and drinking and pain's under control, they can go home.
I stay 3 days and 2 nights at Northwest before heading home to begin the toughest part, rehabilitation.
And for 3 days afterward, I feel like Superwoman and make great strides in recovery. But then the anesthesia wears off. So join me tomorrow for the final segment of my series where I take you through the first 2 weeks of my rehab. Well, earlier this week, I brought you along for my initial visit with the orthopedic surgeon to my actual knee replacement surgery. After leaving the hospital, I went straight home for an intensive rehab program. In the final segment of my series, you'll get an up-close view of the first 2 weeks of that journey.
Rehab begins in the hospital and continues at home for the first few weeks. A health nurse and physical therapist make house calls to make sure everything is in order.
It's very important to clear the pathway, the surrounding where the patients go, usually bedroom to the restroom. We need to clear that. The electrical cords that you use to hook your ice machine, because you could easily trip on them and then fall.
Certain necessities are needed, many of which are not covered by insurance. Those include a special bath chair to get in and out of the tub, a toilet seat with handrails, an aerobic step to get into the bed, a leg lifter to assist while gaining strength back, and a reacher for those hard-to-get items. Insurance usually covers these items to take from the hospital: compression stockings to prevent blood clots, an ice machine to keep swelling down, and a continuous passive motion machine, or CPM, a mechanism that keeps the leg constantly bending and extending. Patients with total knee replacements are supposed to use this machine a minimum of 2 hours in the morning and another 2 hours at night.
So you got to do this one and the one where we put the bolster under your knee and lift your leg, where you did poorly.
Yeah.
Okay, so keep doing it. Everybody knows this who had the knee surgery. When you go upstairs, you lead with a good leg, and then when you're going downstairs, you go down with a bad leg first.
About a week after surgery, I had progressed from a walker to 2 crutches outdoors and a cane indoors. Since my house has multi-levels, learning to climb steps was an important part of my rehab.
Well, fortunately for the lower extremity, it's fairly simple. You're looking on quadriceps, which is the big muscle that's kind of your shock absorber, okay? And then calf muscles and some of the other muscles around the knee to get their strength back and flexibility.
To my patient, I generally want them to get to 90 degrees in the first 2 weeks. Ultimately, we want to bend your knee close to what the other knee has been doing.
Extending the knee is equally important. Without a straight leg, you may walk with a limp.
So I'm going to start pushing. When I tell you to start counting, count 1 to 15, okay? Bad position is to put pillow or anything under the knee when you're laying down, because again, we want to keep the knee straight.
Within 10 days, I'm walking outside. The fresh air feels so good, I start doing it on a daily basis.
Don't be afraid to put weight on your right leg, and do not put too much weight on your crutches.
Meanwhile, a home care nurse is taking care of other needs, including pain control.
We always say, try to take your pain medicine, because the whole purpose of physical therapy, as you know, is to get you moving. And moving it, you're not going to want to do when you're in pain.
She also discusses signs of infection.
Signs and symptoms of infection is what we really are concerned with. And those would be fever, redness, swelling, drainage, and sometimes maybe even odor.
Knee surgery is one of the times when it's important not to cut back on prescribed narcotics. That's because it's often painful to get full extension and flexibility. Without mobility, scar tissue can develop, and that could require another surgery, something I'm trying to avoid at all costs.
How hard is it?
Hard. Yeah,
Very hard.
I feel pain in the knee.
I'm also concerned about the extensive bruising on my surgical leg, something the nurse assures me is normal.
It will subside, it'll start from dark and fade down, but it's very common.
The surgeon did 2 sets of stitches, one internally, the other with this set of staples. 2 weeks after surgery, all 33 staples had to come out. I was warned to take pain medication beforehand. The first staple removed hurt, but it was manageable.
That one hurt.
But the 28th staple was a real doozy.
I definitely want you to take another 500 Tylenol.
That needs
Pressure's
to
a little high.
There you go. Good leg first.
I returned to work 6 weeks after surgery, all the while continuing outpatient physical therapy for several months, working toward my ultimate goal.
For me, I'm a dancer. That's what I do on
Yeah.
my rec time. So how long do you think somebody...
I think you're going to do very well, and I think probably in the 4 to 6 month period you'll be doing some of that.
And as a post note, it's been 10 weeks since the surgery and I've progressed quite well, according to my physical therapist. Just a few more weeks of therapy to go. Hopefully this series helps others who may be considering a total knee replacement in the future.